Friends, welcome back to ophthalmology for undergraduates and postgraduate beginners. We have already presented the case, we have told the diagnosis also. Now it is the students' turn to write about investigations for the long case, discuss about investigations for the short case. In ophthalmology, that too in the anterior segment, 95% of the cases a student sees does not need any diagnostic investigations. They don't need any investigations to make a diagnosis. Only 5% of the cases they need investigations. Investigations can be classified as diagnostic and treatment perspective investigations. Diagnostic investigations usually are not needed for an undergraduate, but treatment perspective investigations are needed. Treatment for a particular case may be a medical management or a surgical management. If it is a medical management, you may choose certain drugs to be given for the patient. Those drugs may have a systemic side effect. They may affect one or other organs in the body. So, if you know that the particular drug you are going to give is going to cause serious systemic side effects, if it is going to be a hepatotoxic drug, if it is going to be a renal toxic drug, if it is going to cause increase in the blood sugar, then we have to find out what is the basic renal function test, what is the blood sugar level of the patient, what is the liver function test. So, if it is needed, we have to do. Otherwise, we need not do it. Investigations for doing a surgery is divided into 4 groups. It is not only in ophthalmology, any branch of medicine. If you have planned to do a surgery, you have to follow this 4 sets of investigations. It is definitely needed. So what are the sets of investigations you should do? One is the physical fitness. Any surgery, the patient should be physically fit to undergo surgery. The surgery should not cause any morbidity or mortality to the patient. So, even if the patient does not have any physical illness, certain investigations has to be compulsorily done to see that the patient is physically fit to undergo surgery. The next set of investigations are investigation pertaining to that particular organ where you are going to do surgery, whether it is fit or not. As far as ophthalmology is concerned, I should be fit to undergo a surgery. I should not have any infection. I should not have any increased pressure inside. So all these things will affect the outcome of the surgery. So we have to do investigations to rule out infections in the eye. We have to do investigations to rule out increased IOP in the eye. We have to do investigations to rule out inflammatory process inside the eye. That way your post-operative period will be uneventful for the patient and the patient will have a very good results following a surgery. The next set of investigations you have to do is prognostic indicators. You are going to do a surgery for the patient. The patient will definitely have an apprehension whether I will become normal or not following this. Suppose the patient is having a defective vision in the eye for which you are going to do a surgical treatment. Patient will definitely ask you whether my vision will come back to normal or not. For that, you have to answer the patient properly and scientifically. You should know whether the patient will get good vision following surgery or not. For that, certain investigations has to be done, and based on that investigation scientifically, you have to explain the patient your vision will be good following surgery, your vision will not be good following surgery. Okay, like that you have to explain the patient and get his consent before doing a surgery. The next set of investigations is specific for the surgery. Suppose a patient is going to undergo a valvular replacement in the heart. Each patient will not have the same size valve to be implanted. So you have to measure the size of the valve. Then only you have to procure that and you have to implant the valve in the patient. Similarly, in cataract surgeries, we are going to keep IOL inside the eye. Each person needs particular IOL to be kept inside the eye. Particular size of the IOL may be needed according to the age group also. So we have to calculate what is the IOL we are going to keep inside the eye. What is the implant you are going to keep in the patient. That way we have to calculate that and keep the exact implant that has to be placed. So these are the 4 sets of investigations, very essential for all patients undergoing surgery in all branches of medicine. We will stop here. We will talk more about this when we go for particular cases for undergraduates. I want to tell one more thing here. Whenever we ask the students what investigations you will do in an ophthalmology case, they will spontaneously say, I will check the visual acuity. This is totally wrong. Visual acuity is a part of an ophthalmological examination. It is not an investigation at all. You should not do that mistake while presenting the case or in the examination. We will stop here. Thank you. We will see in the last video for case presentation for undergraduates tomorrow.